Hey everyone, thanks for coming into the presentation today. We're going to be talking about the heart of the problem, cardiovascular disease, and oral health. So some of the objectives and goals we have for today, we're going to be talking about the oral systemic links between cardiovascular disease and oral health and periodontal disease. We're going to talk about improving oral health habits and caries prevention, improving nutrition, and improving oral health literacy.
Indiana ranks 39th for the prevalence of heart attacks in the United States. CVD is the leading cause of death in Indiana, and in 2018, Vanderburgh County had a greater incidence of CVD deaths compared to the national average of the U.S. 28% of Vanderburgh County's population is obese, and 47.2% of adults aged 30 years and older have had some form of periodontal disease. 70.1% of adults 65 and older have periodontal disease.
If you have a healthy mouth, you are more than likely to have a healthy body just because of the correlation between periodontal disease and CVD. Patients with periodontal disease are 4 times more likely to have a heart attack or a stroke. And that's due to the chronic inflammation that's present in the body and then long-term presence of plaque as well.
Now we're going to work on understanding the link between periodontal disease and cardiovascular disease. So bacteria in infected gums break down the barrier between the gums and the underlying connective tissue in the mouth. That leads to the gums and the rest of the oral tissue becoming inflamed, which increases redness and bleeding. And then during normal chewing or brushing, bacteria can actually enter the bloodstream and then move through the blood to other parts of the circulatory system. As that bacteria moves through the circulatory system, it actually has a potential for worsening that arterial plaque and increasing the negative effects on cardiovascular health.
Some risk factors for periodontal disease include taking medications that cause xerostomia or dry mouth, smoking, diabetes, poor oral hygiene, stress, and genetics.
And then just take a minute to think about what you guys know about periodontal disease thus far. Periodontal disease doesn't only affect the gums, but also the teeth and surrounding oral tissues. And the first stage is gingivitis, which is reversible. So if you notice a patient with inflamed gingiva, but there isn't really any major recession or things like that, it can be fixed. And so that's because there's no bone loss. But then once you get into bone loss or periodontal disease, that's irreversible because you can't grow bone back. So the only thing you can do is try to keep the periodontal disease from advancing and getting worse with proper care.
So what are some signs of periodontal disease that you all can think of? Here's what to look for in a healthy mouth, gingivitis, and then moderate to severe periodontal disease or periodontitis. There are swollen or tender gums that are red or inflamed. There'll also be bleeding while brushing or flossing and pain while brushing and flossing as well.
So some things that you could do for home oral care is using an electric toothbrush is more efficient than a regular toothbrush, and using the modified bass method, which you angle your soft toothbrush at a 45-degree angle towards the gum line and flick the toothbrush away from the gums in a J shape.
With a modified bass technique, you're going to have the toothbrush angled toward the gum line, and as you're brushing, you flick it away just to get the biofilm that's on the gingival margin and just go through the whole mouth in that motion.
So for at-home interdental care, we have a couple of options. The first one is flossing with traditional string floss. So once that floss is between the teeth, you want to move that floss up and down the tooth and also use a C shape to hug the sides of the teeth to make sure you're getting all of that plaque off. The next option is floss picks, which we have a picture of on the screen, and that you'll use in a similar way. You just kind of move it up and down and kind of over direct it to kind of wrap around the teeth. The next option we have are water flossers, which would shoot water towards the gum line and really get rid of that plaque that way. And you can actually use water or a mouth rinse like Listerine antimicrobial or the purple fluoride Listerine. And then the next option we have are interdental brushes. And those are going to be really great for if you have gaps or spaces in your teeth, because it'll get that plaque and that biofilm off of the teeth more efficiently than a string floss, just because the string floss is so thin compared to the brushes.
An example of antimicrobial mouthwash is Listerine, and it has many different options that you can choose from. Oral cancer checks, checking the sides of your tongue and your lips for any suspicious areas.
And this is just a visual of places you can be looking for any abnormalities. And like she mentioned before, especially focusing on the lateral borders of the tongue and the lips, because those are really common areas for oral cancer to form.
So how does nutrition affect oral health? For nutrition, sugary, sticky carbohydrates can fuel that bacteria in the mouth that causes cavities. Some examples of that are candy, gum that isn't sugar-free, and a lot of desserts as well. Acidic foods and drinks are another example of ways that can weaken the enamel, and that would include sodas, coffees, energy drinks, stuff like that. And things that you can do to combat the sticky, sugary, acidic foods is by drinking a lot of water. That'll help rinse out the mouth, and if you drink tap water, that'll even help provide fluoride for your teeth that helps remineralize that enamel as well.
Some local dental offices are Heritage Family Dental, Diamond Valley Dental Care, and Aspen Dental, and all of them have their address right there.
And then some other options, especially for those that do not have dental insurance, or Echo, which offer cleanings, fillings, extractions, and then you can even get a partial denture or a full denture. You do not have to have insurance, and they also accept Medicaid and Medicare. They are open Monday through Friday. And then there's also USI Dental Clinic, and you don't have to have any type of insurance at all. Regardless, adults are $35 and veterans are free. And then children are $10 and adolescents are $15. And they also offer cleanings, radiographs, sealants, and a dental exam all within that price. And then evening hours are also available for those that work during the day, and so they could come in after work.
And thank you all for joining us today for this presentation. We really appreciate you taking the time to watch and hope you enjoyed and learned a couple things along the way.